Hi, my name is Rohan Melwani, and I'll be presenting on cannabinoids as a therapeutic treatment for Alzheimer's disease. So first in the introduction, I'll be covering the background information on Alzheimer's disease and current treatment options. Then I'll go into the properties of cannabinoids, then their wider application and further areas of study, and then I'll summarize the information that I've presented. So why did I choose this topic? I chose this topic because Alzheimer's disease rates are on the rise, and part of this is due to the lack of a cure or a sufficient treatment. So I want to explore treatment options, and I chose cannabinoids specifically because of their spotlight in the media and the rumors for their medical potential. So I want to see how this could be applied to Alzheimer's disease. So what is Alzheimer's disease? It's the most common neurodegenerative disease in the world, and it's the most common form of dementia as well. And it's characterized by unique neurodegenerative processes which result in progressive cognitive decline, specifically functions relating to memory and memory formation. So the biology of Alzheimer's disease, it's characterized for its beta amyloid plaques and tau plaques, which form neurofibrillary tangles. These tangles and plaques interact with neurons and damage them or eventually cause them to die, which results in brain atrophy. And all this neuronal death is responsible for the cognitive decline and dementia that comes as a result of this disease. And there isn't one specific factor that results in one developing Alzheimer's disease. It's rather as a result of multiple genetic and environmental risk factors, in which I've listed a few on this slide. So current treatments for Alzheimer's disease. There are two primary treatments that aim to slow down the progression of the outward symptoms of Alzheimer's disease, such as the cognitive decline and dementia. And then there's two classes of supplementary treatments, which aim to manage some of the disturbed behaviors, such as agitation and aggression experienced by patients with Alzheimer's disease. And then lastly, there's a new class of drug called monoclonal antibodies, but they have been ineffective in treating Alzheimer's disease. So obviously there's a gap in the current treatments. There's a need for a drug that addresses the root cause and the underlying biology of Alzheimer's disease and doesn't carry a lot of side effects as the current treatments do, even though they do not fully address Alzheimer's disease's biology. What are cannabinoids? So cannabinoids are derived from the cannabis sativa plant, and they interact with the endocannabinoid system. And there are hundreds of cannabinoids, but I'll be focusing specifically on cannabidiol and delta-9 tetrahydrocannabidiol, better known as CBD and THC. And they're viable treatments for Alzheimer's disease because they have behavioral, neuroprotective, and neuroregenerative effects. So the behavioral effects of cannabinoids, they have been shown to reduce agitation and aggression, as well as other neuropsychiatric and disturbed behaviors. They also have positive impacts on sleep and eating habits. So now let's go into the effects that address the root cause of Alzheimer's disease. So both CBD and THC have these first four properties, which are very important in treating the actual biology of Alzheimer's disease. And as you can see, there's some specific properties to THC and some to CBD. It's continued on this slide as well. But essentially, CBD and THC actually slow the progression of the biology of the disease rather than just the outward symptoms by reducing the production of the beta amyloid and tau plaques, as well as removing them from the brain. And they further protect the neurons from the effects of these plaques and tangles. They also have the ability or CBD specifically has the ability to promote hippocampal neurogenesis, which is essentially allowing the brain to regenerate and bounce back from the effects of Alzheimer's disease. And it does this in two ways. The first way is via cell proliferation, where it stimulates pathways that promote neurogenesis. And the other way is increasing the cerebral blood flow, which is something that is reduced by 10 to 28% in patients with AD. So this would help compensate for that and allow the brain to bounce back. So side effects. So THC specifically is a psychoactive compound, so it does produce euphoric effects, and one can develop tolerance to it. But if used in combination with CBD in a proper ratio, then dependence and these psychoactive effects can be mitigated. There are also a few mild common side effects that I've listed on the slide over here, and then there are some mild side effects that come as a result of interactions with other drugs. There are, however, two alarming side effects that happen as a result of really high doses of CBD and THC. Neurotoxicity and male reproductive damage can happen when used in very high doses. But thankfully, most of the positive effects were achieved in low to moderate doses. These effects would be mainly avoided in treatment. So here I've summarized some of all of the properties I've covered on CBD and THC. As you can see, THC does lack a lot of the properties that CBD has, but this is most likely as a result of the lack of studies on THC, because most of the studies focusing on cannabinoids as a therapeutic treatment have been focused on CBD and have, for the most part, avoided THC. So let's look at the further application of cannabinoids. So it's currently used already in the treatment of multiple sclerosis and seizure management in patients with Dravet syndrome and Lennox-Gastaut syndrome. But I believe it can be applied to tauopathies because they have a similar biology to Alzheimer's disease. So these neuroprotective and neuroregenerative properties that have been observed would be very helpful in the treatment of tauopathies as well. It can also be applied to schizophrenia because it can reduce psychotic and disturbed behaviors, as well as sleep disorders and anorexia because of their abilities to regulate circadian rhythms and appetite. And it can also be applied generally because of its behavioral effects. So any diseases that cause agitation or other disturbed behaviors can be reduced by cannabinoids. Further areas of studies are in limitations of CBD and THC are that there's an enzyme called cytochrome P450, which interacts or CBD inhibits it, and it's used in a lot of drugs, including clozapine, which is a treatment for Alzheimer's disease. However, clozapine does have alternatives, so proper treatment for Alzheimer's disease can be carried out in combination with THC and CBD without any negative interaction. But the clinical trial system also has flaws for proving long-term neuroprotectivity. So this is proven to be a barrier for the approval of cannabinoids and other treatments for Alzheimer's disease. And some may argue that cannabinoids aren't actually relevant, and they've just been sort of in the spotlight in the media for only recently, and they don't have a further medical application. But the studies I've cited, some of them go as early back as the 1970s. So it has been heavily studied in the medical community for over 50 years now. So it does have some medical potential. To conclude, cannabinoids show a lot of potential in addressing the root cause and underlying biology of Alzheimer's disease. But future studies are still needed to verify the safety and efficacy of these compounds, specifically of THC, because like I said earlier, it has been understudied compared to CBD. And it's still important to note that CBD and THC are not a cure-all by any means. They still have some side effects. So they do show a lot of potential, but they aren't a miracle drug. And so thank you for listening. If you have any questions, feel free to email me at rohan.melwani@gmail.com. Thank you.